Hi there. Hello there, Mr. Filipov.
Hello.
I've got a question about the glycemic index. What does it mean?
The glycemic index is a measure of blood glucose raising potential of food. That's complicated. Here's what this means. We all know that food contains different types of carbs, simple or complex, and simple carbohydrates prevail. Our body is only capable of digesting either glucose or starch, which breaks down to glucose in our body. Other carbs are out of our scope of interest. Some of them are digestible, others are not. It is only glucose that matters for diabetic patients, as insulin is required to digest it. But in diabetes mellitus, the body does not produce enough insulin. The glycemic index is not much of an issue for people living with type 2 diabetes, except for those taking insulin, including prandial insulin. But for people with type 1 diabetes, this issue is more or less significant and, I would say, even important.
Is it really important? I mean, should we really know about it and use this knowledge?
We should. The thing is, if we disregard the glycemic index, we may calculate the dose of insulin incorrectly. Why? As we calculate the amount of carbs, we typically look at the label. What we can see there is proteins, fats, and carbs.
Well, carbs.
The label shows all carbs, including those that need insulin for digestion, and those which do not. We are only interested in the insulin-digested carbohydrates. So if we have a low glycemic index product,
That's clear.
and a glycemic index is, well, simply put, it is a share of glucose in all carbs this food contains. That is, if we have a low glycemic index, it means that there is a very small share of glucose within the overall carbohydrate content. The rest are other types of carbohydrates,
The rest are other types of carbs.
which do not require insulin. But our dose is based on total carbs, and there is a risk of overdose.
Now I see.
For high glycemic index products, where almost all carbs are present in the form of glucose or starch,
What are these? Do these products have the highest glycemic index?
there is a common misconception. For some reason, the glycemic index is often used as a measure of carbohydrate absorption rate. I mean, the two get conflated. The rate of absorption and the glycemic index, in this opinion, is rampant online too.
Absolutely. You can come across such discussions.
And it gives rise to recommendations like, please don't eat foods with high glycemic index. But the truth is, the glycemic index has nothing to do with the rate of carbohydrate absorption. Let's look at examples. What do you think will be faster to absorb, honey or potatoes?
Honey, I think. We use it to revert hyperglycemia.
Well, make a wild guess. All right, apple or bread?
An apple, especially if it's sweet.
Well, now look, the glycemic index of potatoes is 98%. And for honey,
And for honey, is it 100?
is it 100? In fact, it is below 50 for honey. Why? Glucose accounts for less than 1/2 of carbohydrates in honey. It contains a lot of fructose. An apple or bread? Bread has a glycemic index of about 80%. For an apple, it is 50.
It must be fructose too.
It contains a lot of non-glucose. This is all confusing. It seems that products that are absorbed fast are more harmful. But the products with a low glycemic index pose a threat in terms of insulin dose calculation. Because if we calculate in bread units and we eat the same amount of them, but today we eat bread and the next day we eat honey, I mean the same number in bread units, so we inject the same dose of insulin because we have eaten the same number of bread units. But in this case, we will have an overdose for honey.
That means that, besides bread units, there are other factors like glycemic index that need to be taken into account.
But in real life, people, of course, there are endless tables. All these glycemic indexes can be found in cookbooks, but people never count the glycemic index in their everyday life. In practice, we just advise you to remember the products, even categories of products, with a low glycemic index. For foods with medium or high glycemic index, we just count bread units or grams. But if the index is low, we just reduce the dose of insulin for that product.
That's clear.
to avoid overdose.
Yuri Ivanovich, thank you so much for such a detailed answer. It's very tricky, but I understand that the rate of absorption and the glycemic index are absolutely different concepts.